Number 5. Health, including social care, mental health, and well-being. We share the long-term goal for health, mental health, and well-being set out in the BSL National Plan, which is BSL users will have access to the information and services they need to live active, healthy lives and to make informed choices at every stage of their lives. Our actions. By 2024, we will signpost BSL users to health and social care information available in BSL. To be produced by NHS Health Scotland and NHS 24. And develop information in BSL about local provision as appropriate. Undertake a self-evaluation to allow social work services managers to consider a range of accessibility issues, including awareness amongst staff of how to signpost to the relevant information available in BSL. We will then build on the findings of a self-evaluation. Scope the provision of formal certified BSL training for appropriate frontline HSCP staff. Scope where deaf awareness training would be most appropriate and most effective. Ensure opportunities presented through improved use of technology are acted upon. Explore the use of phone scannable codes, QR codes, to access virtual information concerning deaf organisations and deaf clubs for BSL service users. Continue to work with care homes to highlight and record sensory loss and communication needs in clients' records when they enter into care homes. Review existing deaf access to self-directed support, SDS, and map the care pathway currently available to BSL users, and develop an action plan. Ensure specific focus on access to services for BSL users is included in advocacy contract monitoring meetings. Continue to develop BSL information on the Your Support Your Way Glasgow website, including information on deaf organisations and clubs, health and social care supports, and sport and leisure opportunities. Include a short welcoming film in BSL on the homepage of the Your Support Your Way Glasgow website. Scope options for pre-flagging BSL users on client records in order to facilitate appropriate translation or interpreting services in advance of specific appointments and general engagement. Complete the review of the BSL Interpreting Services and report on the recommendations by end March 2019. We will work closely with NHSGGC through Glasgow's Integrated Joint Board, IJB, to ensure that psychological therapies can be offered on a fair and equal basis to BSL users. Launch a suite of films, Positive Signs, on mental health and resilience messages, and use as part of HSCP mental health services promotion. Review access routes to psychological therapies, including how BSL users can access at local level and on a fair and equal basis. Take steps to improve access to information about sport and physical activities, local sport facilities and opportunities. Continue to support deaf children to attend swimming lessons by ensuring that swim coaches are appropriately trained to offer deaf-friendly swimming. Scope options for BSL signing at Glasgow Life operated sporting events. Continue to support interactive participation in walking groups through the use of visual and tactile materials for individuals, groups, and their interpreters. Continue to support countryside ranger talks for West of Scotland Deaf Children's Society. Ensure that any local work to tackle social isolation explicitly considers the needs of BSL users. Using direct links established with the campaign to end loneliness, there will be a specific focus on tackling isolation for older BSL users.